Committee will now receive testimony from the witnesses, and I'll call up our first panel. Let me introduce each of them at this time, if I could. Starting on my left is Ralph G. Is it Nees? Nees, who is Chief Executive Officer of the National Coalition on Healthcare. Next to him is Richard Kirsch, who is National Campaign Manager for Healthcare for America Now. Good to see you. And then we have Dr. Stephen T. Parenti, who is Director of the Medical Industry Leadership Institute. And this panel is on Health Reform Coalition Views. I'm going to ask each of you to give a 5-minute statement. Of course, your full statement becomes a part of the record, and then when you're done, we'll start having questions from the panel. And we'll start with Mr. Nees. Thank you for being here.
Chairman Pallone and Ranking Member Burgess and members of the full committee and subcommittee, thank you so much for the opportunity to appear before you on this momentous occasion, day one of hearings to discuss the House Tri-Committee Healthcare Reform Discussion Draft. I'm pleased and proud to be joined by the founder, the visionary founder and president of the National Coalition on Healthcare, Dr. Henry Simmons, who's sitting right behind me. Among many other things, Dr. Simmons was the Deputy Assistant Secretary to President Richard Nixon for Health in the early 1970s. The National Coalition on Healthcare is honored to be here and heartened by the progress made by the three committees. We hope that this draft bill can serve as the springboard for comprehensive and sustainable healthcare reform. Like you, we believe that the time for action is now, this year. Reform of our healthcare system is a vital condition precedent for fixing the nation's faltering economy. The fiscal crisis facing us cannot be addressed successfully without the simultaneous overhaul of our healthcare system. America is on a dangerous path to sharp increases in the cost of healthcare and the numbers of uninsured and underinsured Americans, to unsustainable burdens on our economy and on federal and state budgets, into indefensible, avoidable harm to millions of patients and massive waste from substandard and uncoordinated health care. The rigorously nonpartisan National Coalition on Healthcare is the nation's oldest, broadest, and most diverse alliance of organizations working for comprehensive healthcare reform. The Coalition's 78 member organizations stand for more than 150 million Americans. The Coalition's 5 basic principles for healthcare reform: coverage for all, cost containment, improved quality and safety, simplified administration, and equitable financing are interdependent. We believe reform, to be effective, must address all of these issues in a systemic way that recognizes their interconnectedness. After more than 18 months of deliberations, the Coalition developed a set of principles and specific recommendations. I would ask that they be included for the record along with my written statement. As the Coalition operates on the basis of consensus, we have begun an expedited process of discussing the provisions of the draft bill with our members. Only as these internal consultations progress will we be able to provide more detailed views and consensus recommendations regarding optimal formulation of the final bill. However, let there be no doubt that the Coalition strongly commends the cross-jurisdictional, collaborative tri-committee effort to address the central challenges facing our nation in healthcare, specifically how to slow the growth of healthcare costs, how to extend coverage to Americans without health insurance, and how to improve the quality of care and the efficiency with which it is delivered. The draft is appropriately ambitious in its scope and its recommendations. We believe that reducing costs while expanding coverage not only can be done, but must be done. Now is the time to be pragmatic and bold, to keep what is good and to fix what is broken in our nation's healthcare system. We must come together to pass systemic reform that sets our nation on a better path toward affordable, high-quality care for all Americans in solid fiscal responsibility. The Coalition members have long believed that securing coverage for all Americans should incorporate a range of mechanisms, including responsibilities for individuals and employers, the expansion of existing public programs such as Medicare and Medicaid, information and framework to improve competition among private insurance plans, and the creation of an additional and carefully designed public option. The Coalition would encourage consideration to be given to adding detail to the definition of the service to be covered in an essential benefits package. Many of our members would want us to emphasize the importance of calibrating the provisions regarding the public option to make sure that it would function as the drafters clearly intend, on a level playing field with other plans. We applaud the inclusion of a wide range of measures to improve the efficiency of healthcare delivery while enhancing the quality and safety of care and also providing support for evidence-based prevention. Escalating healthcare costs put healthcare coverage out of the financial reach of tens of millions of Americans and their employers. Thus, we suggest consideration of the use of short-term regulatory constraints to slow the pace of increase in the cost of essential coverage. The Coalition applauds the Chairman for the leadership. The enormous added momentum your joint efforts have given to the reform process cannot be overstated. Indeed, this is truly an extraordinary moment in history. Too much is at stake for us to risk failure due to partisanship. It is only through a commitment to shared responsibility and shared sacrifice that we can rise to meet this once-in-a-generation opportunity to develop an achievable and uniquely American solution. To protect the generations to come, let us work together to enact health care reform that is at once moral and fiscally sound. Thank you, Mr. Chairman.
Thank you, Mr. Neese. As I mentioned, all of your written testimony, your documents that you gave me would be included in the record, so you don't have to make a special request for that. Mr. Kirsch.
Good morning, Chairman Pallone, members of the committee. Says on. Is that better?
Yeah, but you bring it closer to you. Yeah, that's a problem too. Is it on? Does the green light on?
Working or not?
That's good.
There we go. Okay, yeah, the light just came on. Great, thank you. Again, good morning, Chairman Pallone and members of the committee. My name is Richard Kirsch. I'm the National Campaign Manager of Healthcare for America Now, a coalition of more than 1,000 organizations in 46 states that are committed to a guarantee of quality, affordable health care for all. According to specific principles, those principles have been endorsed in writing by the President of the United States and 196 members of Congress, including 176 members of this House from both parties. And I'm so glad to be with you this morning because the legislation you have drafted meets those principles. It would deliver on the promise of quality, affordable health care for all in a system that is retooled to deliver better quality at lower cost. You've done so in this unique tri-committee process that recognizes the urgency and historic imperative of this issue. Our current healthcare system is a huge stumbling block to the American dream. No matter how hard we work or make responsible choices for ourselves and our families, our healthcare system too often gets in the way. For too many families, one serious illness can mean financial disaster, as medical costs contributed to more than 3 out of 5 personal bankruptcies, and the great majority of those were people with insurance. And even if you have good insurance, you find your choices limited and your dreams deferred. You want to look for a new job, start that new business, retire at age 59, trapped because you won't be able to get affordable coverage if you can get coverage at all. And of course, there are too many families that can't get coverage at all. Neither can many small businesses, that other great engine of the American dream, who want to do the right thing for their employees, but can't as healthcare premiums skyrocket every year. The good news is that we can fix what is wrong with the system with a uniquely American solution. For those who say we can't do this, it's too complicated, it's too much to take on, it's too much at once, your legislation is proof positive that yes, we can. As Americans begin to pay attention to the healthcare debate, they will increasingly ask, what does this mean to me? Here's how I would explain how this works to the average American and why it will make their lives better. If you have good health coverage at work, you can keep it. But there will be 2 important changes. Under your legislation, you no longer have to worry about your coverage at work getting skimpier every year or your employer taking a bigger chunk each year out of your paycheck. Your employer coverage will not be bare bones. It will cover most of your health care. It won't stop paying if you get seriously ill. Your job will pay a good share of the coverage for you and your family. One more thing, whatever job you take, you'll have good health care. That's because all employers will either provide coverage or help pay for it. If you don't get health coverage at work, or you work several part-time jobs, you're self-employed, an early retiree, or simply out of work, you'll now be able to get good, affordable coverage. You won't be turned down because of a pre-existing condition or charged more because you've been sick or you're a woman of childbearing age. You can still be charged more if you're older, but only so much. And how much will it cost you? The amount you pay will be based on your earnings and the size of your family, with assistance for low, moderate, and middle-income families. To get insurance, you'll go to a new marketplace called an exchange, one-stop shopping for health coverage. All plans will have a decent level of benefits and play by the same rules. No matter which plan you choose, your out-of-pocket costs will be limited, no more catastrophic medical bills. You'll have a choice of a new public health insurance plan, too. So you won't be limited to the same private insurance companies that have a record of denying and delaying care while they raise premiums 3 or 4 or 5 times more than wages. As the President says, there are 2 reasons for offering the choice of a public health insurance plan. The first is to lower costs, a plan that doesn't pay the average CEO $12 million a year or have sky-high administrative costs. The mission of the public health insurance plan will be to drive the kind of delivery system changes we need to innovate, provide better value, and invest in our community's health. A plan that will inject competition into the 94% of markets that are anti-competitive under DOJ standards. The second reason the President says we need a public option is to keep insurance companies honest. The 93% of Americans who don't trust private insurance companies know that no matter how much we regulate them, their first order of business, actually their legal fiduciary responsibility to the shareholders, is to make a buck. And when they pay for someone's costly care, their profits go down. An additional reason for the public health insurance plan is to ensure they make real progress in eliminating the barriers and disparities in access to needed services that are too often experienced today. Poll after poll shows strong support for the choice of public health insurance plan with strong support on bipartisan lines. This legislation also answers the crying need of small business for affordable coverage by offering tax credits and allowing small business to enter the exchange. It gives them the advantage of large pools and lower costs. Your legislation does a great deal more for the poor through Medicaid, for seniors on Medicare, to address the lack of primary care providers and the disparities in access to health care. I'm almost done. Are there ways we'd improve in this draft? Although they're not a great number, and we'll detail them in a written testimony. Let me conclude by asking you to keep one question in mind over the coming weeks, as you hear from a myriad of interest groups complaining about this and that. It's the question that your constituents will ask at the end of the day. Will I have a guarantee of good coverage that I can afford? The draft legislation you presented answers with a resounding yes. And if the answer remains yes next fall when you send a bill to the President for a signature, you'll have done your jobs, and in doing so made history. Thank you.
Thank you. Dr. Parenti.
Thank you, Chairman Pallone and members of this committee for this opportunity. We are in the midst of the 7th major attempt of national health reform, beginning with the Wilson administration. Since that first attempt, there has been President Roosevelt's second attempt in 1936, President Truman's third attempt in 1948, President Johnson's fourth attempt leading to a compromise that created Medicare and Medicaid, President Nixon's limited fifth attempt, President Clinton's sixth attempt. With President Obama's call for reform, will 7 be the lucky number? My name is Steve Parenti. I'm a health economist from the University of Minnesota and a principal of a healthcare consultancy, HSI Network. My areas of expertise are health insurance, health information technology, and medical technology evaluation. At the university, I'm a director of an MBA specialization in the medical industry and a professor in the finance department with an adjunct appointment in the Johns Hopkins School of Public Health. Most recently, I and my colleague Lisa Tamai from HSI have scored health reform proposals as they have emerged in the last 4 weeks. We are using ARCOLA, a microsimulation methodology initially funded by the Department of Health and Human Services and published in the journal Health Affairs. There are 2 things people most want to know about these proposals. 1, how many of the uninsured will be covered? 2, what will it cost the nation in 1 year and in 10 years? HSI estimates, like CBO's recent results, find there is no free lunch to expand health insurance coverage. Our early assessment of the Senate Finance Committee proposal shows a 74% reduction in the uninsured with a 10-year cost of $2.7 trillion, using public option plan modeled after the Massachusetts Connector. We also modeled an FEHBP version of that plan and got a cost of over $1.3 trillion, but with only a 30% reduction in the uninsured because the plan is generally more expensive and not enough incentives are given. CBO scored the Kennedy bill last week at approximately a 30% reduction for $1 trillion over 10 years. Using the ARCOLA model, we found nearly everyone would be covered if all elements of the Kennedy bill were enacted at a 10-year cost of $4 trillion. That $4 trillion estimate over 10 years assumes a public option plan with bronze, silver, and gold levels in the proposed insurance exchange with a subsidy for premium support that is income adjusted and calibrated at the silver level. The silver level is what most Americans would like in health insurance today. It is the equivalent to a PPO plan with medium levels of generosity, something with a 15% coinsurance, manageable copays, and good access to physicians and hospitals. We accounted for the public plan being reimbursed at 10% above Medicare reimbursement, which is also 10% below commercial insurance plans. In the individual market, we assumed the public option plans would be community rated and the rest of the individual market would be as it is today. For those offered insurance, we assumed a public plan would be, my teleprompter broke. Because the public plan can compete with the individual and group market offerings, we saw a crowd out in the public plan of 79 million covered lives, with the majority of people leaving employer-sponsored medium-sized PPOs and HMOs. At this time, we are the only group yet to score the full Kennedy proposal. We released it last Sunday, June 14th, on our HSINetwork.com homepage, 2 days before CBO's preliminary estimate. This work was completed as a public service without a funder from industry or a political sponsor. Some proposals we examined have specific pay-fors already scored by CBO that can substantially reduce their costs, such as the Coburn-Ryan bill, with a 72% reduction and a 10-year cost of $200 billion with the pay-fors accounted for, or $1.7 trillion without. One conclusion emerges every time we score a plan. None are revenue neutral. Even with Medicare and Medicaid pay-fors, the savings in those programs need to deal with the cost pressures of those programs. In all likelihood, these proposals, if enacted, would escalate the rate of growth of our national debt, particularly the Kennedy plan. As a nation, we are on the verge of making a multi-million-dollar gamble that more per capita health care deficit spending will make us better off as a society. We are wagering with starting bids in trillions that have excessive spending in the healthcare system, hoping that these billions and trillions will lead to a breakthrough medical technology that can eliminate whole diseases such as diabetes and Alzheimer's. This is actually not a bad path. It happened before with tuberculosis, but not quite at this level. It is not an unreasonable wager, since federal funding for heart disease and cancer, either directly through research or indirectly through Medicare, has yielded state-of-the-art medical care, but it is a wager nonetheless. And we find our reckoning is not only with the future debt of our children, but their security when the economic crisis has brought international scrutiny upon the U.S. from the principal purchasers of our treasuries. Furthermore, saving businesses from paying health care costs or a state government with federal intervention is simply an accounting cost shift that only saps our long-term economic growth. President Obama spoke recently in Wisconsin of the need to expand health coverage to bend the cost curve down. I watched him say them 3 times in 5 minutes. May I respectfully suggest that bending the cost curve down starts with active management of Medicare. For 5 months, we have been without a CMS administrator, while there have been over $400 billion in medical
Dr.
claims
Parenti, I
paid.
didn't mean to interrupt, but you were a minute over, so if you could kind of
I'll wrap up. Pardon me. In summary, there is greater consensus today that health care reform must be undertaken. It will not be free. It will, as it always was, a political decision that was more so political than economic. So much can be done now with great expansion, but it will come at great cost. Thank you.
Thank you.